Hi, we want to welcome you to our series on basic first aid. In this video, I'm going to talk a little bit about what OSHA says about first aid, recordable versus non-recordable injuries, and in our next video, Scott Hunter is going to discuss the different basic first aid regulations. So, what does OSHA say about basic first aid? Well, according to standard 29 CFR 1910.152B states that in the absence of a hospital or medical facility, a person or persons shall be adequately trained in first aid procedures and adequate first aid supplies be made readily available. However, when local medical facilities are available, OSHA recommends but does not require that one or more persons be trained and certified in first aid treatment. And that's about the bulk of what OSHA has to say about basic first aid treatment. Now let's talk about recordable versus non-recordable injuries. OSHA has a few rules in place in which they say make up a recordable injury. They are any workplace-related fatality, any workplace-related injury that requires treatment beyond basic first aid, any workplace-related injury that results in a loss of consciousness, days away from work, restricted duty, or job transfer, any work-related diagnosed cases of cancer, any broken or fractured bones or teeth, and any punctured eardrums also make up a recordable injury. There is also special recording criteria in place for Sharps injuries, tuberculosis, and loss of hearing. Now, you have to keep in mind some of these recordables have strict reporting policies. For example, any workplace-related fatality has to be reported to OSHA within 8 hours, and any workplace-related injury that results in amputation, inpatient hospitalization, or loss of an eye has to be reported to OSHA within 24 hours. Now, your non-recordables are basically just the opposite of that list we just described. They're going to be all your minor cuts, bruises, scrapes, burns, anything that doesn't require treatment beyond basic first aid, anything that doesn't result in any sort of lost time or any sort of job transfer or light duty are all going to make up your non-recordables. Non-recordables are still important and should be treated as such by the employer, so that way they don't develop into something more serious in the future. You can always check out the OSHA website for more information on recordable versus non-recordable injuries. We want to thank you for watching today. Stay tuned for the second video in our series. And as always, like and subscribe to our YouTube channel.